Welcome to Mejo's Docuseries on health entrepreneurship. Entrepreneurship in healthcare is vital for addressing Africa's unique challenges and creating sustainable solutions for communities across the continent. In this series, we explore the journeys of three extraordinary leaders: Dr. Ian Clark, an Irish-Ugandan physician, entrepreneur, and philanthropist who founded the Chiwoko Hospital and the International Medical Group in Uganda; Dr. William Mapham, a South African ophthalmologist and founder of Vula Mobile, the oldest African health tech company connecting hospitals to specialists; and Tony Natif, a Ugandan pharmacist, activist, and founder of Garden Health Pharmacy, one of the largest with over 19 stores. Their stories reveal the lessons, challenges, and triumphs that define healthcare entrepreneurship in Africa. Through their experiences, we aim to inspire the next generation of changemakers in healthcare. Every remarkable journey begins with a compelling story. Who are these individuals? What shaped their paths and inspired their passion for health entrepreneurship? From their roots to their motivations, we uncover the people behind the impact.
Well, Anthony Natif is my name. Like I said, I grew up largely in Seta. That's maybe like 20 kilometers from where we are taking this interview in Myenga, I believe. It's just with no traffic, probably that's 25-30 minutes east of this place. Grew up in a family of more than 20 siblings. Were raised by a grandmother. She died at 100, never used a walking stick really in her life. A very tough woman. Our father was a teacher, Cambridge educated, guy, very proud man. Believed in education, still believes to this day that the best gift you can give your children is education. So he's not a believer in bequeathing kids with plenty of wealth in terms of cars, material possessions, and all that stuff. He believed that only thing you have to do is give the kids the best education possible and then get out of the way. And I have to say that's something he stuck on. He educated us in some of the best schools there is in this land. Think Namyango College, where I went myself, Chisubi, Budo, Gayaza, Namagunga, all these seemingly A-list schools at the time. And so grew up in Seta. Did a lot of, because at the time I was coming through the system, my dad had quit his job largely on principle because he felt that things were not going right in the country. So he left his job in the early 90s, citing corruption and all these things. Then went to Seta in Mukono, ran a bar, lodge, restaurant. So as far as I remember, I think from the age of 6, I was buying the shirt on my back and the shoe on my feet. And the way I did that was through fetching water that would sell to the middle class in Seta. I quickly graduated from those jobs and went into collecting money in a movie theater in the community. It was called Modern. I would go to primary school, Seta Church of Uganda Primary School. Class stopped at 3:20, but I always left at 1. And then I'd go to that place, collect as the cashier, collect that money up to like 11 p.m., go home. Granny opens for me. Sometimes she'd come to the door, doesn't want my dad to know I was back late. I say, who is that opening the door? Like, no, that's me, I'm going to pee or something ridiculous like that. She'd cover me up a bit. And I would always give her whatever money I made. She was my banker. And so comes to P7, I added another revenue stream because I was working with largely older people, older men, older boys. These were guys whose lives were going off the rails, so they needed a supply of weed and all that stuff. And I, living close to the well, I knew some ladies who grew weed in a place called Mejo, that side. So I'd go and buy a plant, allow it to grow over a few months, then come and harvest and go and sell. So the criteria for selecting my high school really was availability of bursaries. So because of my father's education background, he and Granny knew that Namiyango College had a scholarship scheme for the best student in class every term. So, and they knew that they didn't have enough money to pay for my school fees. So they essentially said, you go to Namiyango College and tussle it out with these rich people's kids, privileged kids, and if you come out top, you'll have fees for the next time. If you don't, you come back here and we find ways of surviving. And so I remember back then the first fees we paid was 197,000 shillings. So finished P7. I'm the best in Mukono district, I think. Namiyango had segregated dormitories because it had had a history of bullying. Each class stayed in its own dormitory. But I got there and these twos just came and picked me from my dorm because they knew from border men that one of those Seda lords was coming to Namiyango. So I'm like, again there, I go to the S2 dorm, carried my suitcases. Of course, they just wanted me to supply them a bit of weed. And they knew a cool kid was coming in, so which I did for like a term, which was stupid, term or two, until I faced the threat of expulsion and dumped that business and took on money lending on a small scale, really. So by the time I left Namiyango College, I probably had more than 13 million, which my grandmother used to buy land in Mukono, next to Bishop Tucker Theological College. After senior 6, I got into pharmacy school. That time Granny had already bought a plot of land next to Bishop Tucker Theological College, as fortune would have it. That's around the time the college became a university, and it rebranded to Uganda Christian University, and before long they changed their gate to closer to the land, and suddenly land that was 13 million becomes more than 100 million because people wanted to build hostels. So really part of that is the capital that started our journey in Guardian Health. Pure luck. So I go into school, into pharmacy school, dreaming about becoming a professor. So I was chilling one Saturday in the UH quadrangle, making noise with my friends. And this guy, I don't know if you know him, Dr. Ogwang of Covidex. He shows up carrying a Bible. He's looking to do Bible study with some kid, a very stubborn kid in UH. I like Tony, I mean, he didn't know my name, but he keeps asking guys around for this kid, and he looked very disheveled. If you know Peter, if you know Patrick, you know. He looks, if you're going to judge people by their looks, he is not the guy you respect. But thanks to my grandmother, for me my job was to be kind to everyone. I didn't know this guy from Adam. He was a stranger. So I bring Coca-Cola for him and tell him, okay, let me go look for the kid. So look around the entire hall. I didn't find the kid. I didn't have his number at the time. Mobile phones weren't as ubiquitous as they are now. So couldn't call him. So I come back and engage him in conversation. I tell him, when I see the kid, I'll tell him to look for him. And this guy he found flip charts all over the walls of my room. At the time, we had the university had changed the way it taught to problem-based learning. So we students would do most of the teaching, self-teaching. He was like, "Oh, are you studying industrial chemistry?" Because the flip charts had benzene rings and all that stuff. So I'm like, "No, I'm studying pharmacy." Like, incidentally, I'm also a pharmacist and have just opened a pharmacy in Chevando called Genesis. If you would like, you can come and moonlight in the evening after classes. And a lot of students really used to do that. So that's how I got my first foray into the pharmacy, the community pharmacy space. Started going there. The time a taxi from the small gate of UH to Chevando was 200 shillings, so I'm that old. And a Rolex was 500. And he would give me 5,000 shillings every day. And then like 500k, I think, at the end of the month. I don't remember how much he was paying, but it was a lot more than the faculty allowance I was expecting once a year. So I'm like, oh wow, I suddenly hit the lottery. Then a year in, I ran into the Grace of Vine pharmacies. He was buying his, I think, 6th pharmacy. He had the biggest chain in Uganda at the time. So he was buying the pharmacy on the Winton Road, asked us to do stock taking for him. We did it so fast. I looked at the guy, he was super organized. He was young, very polished guy, if you know him. Very nice gentleman. So anyway, that's the guy who taught me the business side of pharmacy. So I asked him if I could work for him, even if it meant working for free. He said okay. He took me to Kamocha, below Kobil. Now it's, I think, Rubis petrol station. There was a pharmacy there close to Bobby Wine's studio. That's how I met all those guys, the musicians. Started working for him in exchange for him teaching me how to do business, and paid me well. He mentored a lot of us. I will forever be grateful to him. And so after pharmacy school, there was only 1 year I was going to go, which was business. And so he helped us buy the first pharmacy with him in 4th year. Went to Granny, sold part of the land, and money Grace would give me through the work I was doing and a few supplies we were making. That's how my journey began.
Well, I am Irish, Irish born, Ugandan Irish now. I've lived in this country for 36 years, so done quite a bit, seen quite a bit. I trained Queen's University Belfast in medicine. Subsequent to that, I did some A&E experience, some obs-gynae, and then I went to work as a family doctor and worked for a while in Northern Ireland. Then I heard about the HIV. At that stage it was mid-80s, mid to late 80s, and HIV was these reports of cases in California and Uganda were coming out of people who had no immunity and were dying from opportunistic infections. I was really in my head, I was like, my goodness, this is amazing, because I was doing fairly routine medicine then. That sparked me, and then the opportunity came to visit Uganda. I came along, I was part of the church, came along just for a visit with a church group, and that happened to be at sometime in 87, and the civil war had finished in 86. Museveni had taken over, giving you a history of Uganda. And Museveni had taken over, so it was kind of the next year after he took over. Things were peaceful in Uganda, and there was a real spirit of renaissance. There was a spirit that people were very, very hopeful for the future at that time. I'd never heard of the Luaro Triangle or the Bush War, but someone took me out there after the war, and of course there was tremendous medical need post-war. So I decided to come and came with my family, got permission, got sponsorship from Church Mission Society, which is the one behind Mejo Hospital, CMS, Albert Cook and all that. So I came out as a missionary, and then I came out to that area, the Luaro Triangle, which had almost no medical care at that time. So I started to train health workers, do primary health care, and very quickly realized that you can train people to pick up risk factors, but if you've nowhere to refer them, So I was actually sending people into Mejo Hospital at that time, and the Luaro Triangle, although it wasn't very far, it was like 85, 90 kilometers outside Kampala, but the roads were completely broken down. So it would take 2.5 hours to get. Now it can take 2.5 hours with Kampala traffic, but then it was just due to really, really poor roads, poor infrastructure. So I quickly realized that I couldn't do a lot unless we built a facility. So that started at the clinic, and it was really the need that drove the development of what became Chiwoko Hospital, which is a Church of Uganda hospital under the Uganda Protestant Medical Bureau. In fact, Mejo Hospital was quite helpful in getting that going. So I have a place in my heart for Mejo Hospital. So I did that for 6 years, and I found myself, and my family were there as well. My kids eventually went to school, boarding school in Kenya. Very much in the height of the AIDS epidemic, which was accompanied by TB, by a resurgence in TB. So we found ourselves treating a lot of TB, and then treating HIV. And of course at that time, this was about 89, 90, there was no treatment whatsoever for HIV. And so it was a question of diagnosing people and then trying to get them living positively with AIDS. And it was a very traumatic time. I spent 6 years, so from up till about 93 there, building this hospital from scratch and treating people with HIV and TB and just seeing people die. And it wasn't, you expected patients to die, but in fact, it was my staff, it was my nurses, doctors, colleagues who were dying. So it was very traumatic. So then subsequent to the end of that, as I say, it was around about a 6-year period. We did build a hospital, open Chiwoko Hospital, and then I got cancer myself and had to go back to Ireland. I didn't really know what I would do after that time. I didn't come to Uganda with a plan. I just came to be useful. Primarily because of my Christian background, I felt that, well, like all young doctors, you don't do medicine just because you want to make money. You do become a lawyer or something. You do medicine because you want to make a difference and because you're interested in healthcare and you've got passion about it. And I'd say it's not all doctors, but I'd say it's the majority of doctors. And I was the same. And when I was in Ireland, I just felt I wasn't making any particular difference to anyone, checking blood pressures and doing routine stuff. When I came here, there was no doctors there. I was it. That's when I learned surgery and did cesarean sections and did laparotomies and did all this stuff. So the need drove me to try and meet it in whatever way I could. So, well, after I got cancer and I got treatment, I actually got testicular cancer, rare as hen's teeth here. Okay, but you can, and so I lost one testicle and I had horrible chemotherapy. But I mean, everybody thought I was going to die because I had secondaries in the lungs, I had metastases in the spinal cord. If you read up on that, you'll find it's often diagnosed by back pain, people who have back pain. But it's much commoner in Caucasians than in Africans. So I had treatment for about 6 months. I then was in the position where I had seen people die of HIV, I had experienced the dread diseases, I'd experienced it myself where I was almost going to die, and I felt I couldn't just go back to being a regular GP in suburban Ireland or England at that time. So that drove me to come back out again, and I did a master's in public health, and then subsequent to that I came out and just started a clinic in Kampala, you know, so like many doctors. So then that over a number of years developed into, first of all, International Medical Center and then International Hospital, and I spent, you know, I started various business aspects of it. So that's sort of broadly what I did, and then subsequently, more recently, I diversified in business and I started a coffee farm. And we have this university and we have a school. So over the years, I've become more entrepreneurial. Yeah.
Okay. Wow.
I think I remember when I was at school, I didn't particularly like school, and I was a very bog standard average student. And I had this opportunity that I could be a farmer and be on the land, or I could do a profession. And so it came down to me was to either be a farmer or to be a doctor. The reason for being a doctor, there's really two reasons. One is I felt that doing medicine would be significant in terms of my meaning in the world, because I remember having lots of debates about the purpose of life and that kind of thing when I was about 14, 15, 16. And so I thought medicine, well, that's a career where you can make a difference. And also I was good at biological science, and I wasn't good at physics and the other physical sciences. So now I really enjoyed the farming, and I would have been a farmer, except farming ties you to one particular location, obviously. And I knew that if I did medicine, then I could end up anywhere in the world, which is, you know, I ended up in Uganda.
Okay, that's quite interesting.
Being an entrepreneur. And when I came to Uganda, then some of that experience, and this is one thing I've learned in life, always take the season you're in, and then always try to garner as much experience and learn things from that season, and you will never know when that will become useful.
So, yeah, my father is from a mixture of Swaziland and Lesotho, and my mother is English, but she grew up in KwaZulu-Natal in South Africa. And how did it all start? So they got together, obviously, and my father worked for a logistics company, so we traveled a lot as kids, and eventually did all my schooling in the UK. The United Kingdom. My father was a computer scientist, so we never had a TV at home, but we always had a computer. And even to this day, I don't have a TV, but we have computers at home. So I guess we learned a lot about how to, what do you call it? I guess we kind of just grew up with a computer in the house, and that was kind of normal. And then I really wanted to become a doctor. There'd never been a doctor in the family before. And I thought that was going to be a lot of fun and easy. But actually, it was very hard to get in. So I didn't get in for the first 2 times, and eventually got into medical school after doing some BSc, which is a science degree. And once I was in, I didn't love medical school. I much preferred being out in the rural areas. So my emotional home is where my grandparents used to farm, which is in the Eastern Cape. It's near to where Nelson Mandela was born and grew up. So if you read The Long Walk to Freedom, that's the kind of area where I'm talking about. So at every opportunity, I would go and do an elective back in the Eastern Cape. Worked in most of the rural clinics and rural hospitals there. And if I have to describe my one passion, it's improving healthcare in rural areas. That's really my driving force. And so once I qualified, I guess you've just finished your internship, so I finished mine, went back to the Eastern Cape. There were 3 of us who worked in a hospital. We served a population of about 250,000 people. So we were very busy, and you have to do everything that patients need. And just to give you one example, and we did a lot of good work, but often there were patients who we didn't give the best care to, and we call them the ghosts of patients past. So this particular patient haunts me because he came with an eye condition and I didn't know what it was. And when you're working in a rural hospital, the patients aren't just unknown to you. You live in the community and everyone sort of knows who you are. And I didn't know what the eye condition was, and I gave him a letter and I said, please go to our nearest eye clinic, which was only 3 hours away. And I hoped then that he would go and get treatment. But later on, as a specialist, I went back to volunteer 7 years later, and he came with the same letter that I'd written 7 years before, and he was so excited to see me again. But unfortunately, he had gone blind in that time, and I realized that looking at it as a specialist, that it was actually a simple condition, had just gone untreated for a long time, and worse of all, we even had the medication he needed the first time I'd seen him. I just didn't know as a junior doctor. So I guess a lot of innovation comes out of my personal experience. And having worked in the rural hospital for a few years, then sort of quit clinical medicine and went into public health. And so we started an organization that recruited healthcare workers for rural hospitals, which was a big problem at the time. Then worked for a company that made mass media solutions for healthcare. So we had South Africa's primetime TV show. At that time, there were only 4 TV channels. So we were on primetime on the top channel. And we blended health messaging into the drama shows, which was incredible. And then saw that cell phones were becoming a form of mass media. So I went to the United States and did a fellowship in mobile phones for healthcare. Worked in Washington for a company called Voxiva, which was the leading company for mobile health at the time. But at the end of the day, making Americans skinnier and smoke less was quite far from my passion of improving rural healthcare. So I came back to South Africa and then volunteered at the eye clinic in Swaziland. It's called the Vula Mejo Eye Clinic, which means open your eyes. And that's where we first had the idea for Vula. So we formed Vula to connect rural healthcare workers with specialists. And we started off in ophthalmology in 2014. 2016, we opened it to more specialties. And as of today, it's used in 70 different medical, surgical, and allied healthcare disciplines. So hopefully that's given you a brief journey through my career.